Hello, I'm Rachel McKenty, Director of Programs and Development at Legacy Education. Thank you for joining me for this CPB practice exam review covering medical necessity. I will provide an overview of key Medicare billing and coding policies designed to ensure proper claim submission and prevent overpayment. We will cover the National Correct Coding Initiative, NCCI, which addresses improper coding practices, and procedure-to-procedure edits, PTP, which identify code pairing combinations that should not be built together. Additionally, we will explore the use of modifier indicators that allow exceptions to these edits and discuss medically unlikely edits, also known as MUEs, which limit the number of services that can be billed for a patient on a given day. Together, these topics form the foundation for accurate medical billing and compliance. We will now review questions from the CPB practice exams with detail-rich rationales. When using the practitioner PTP edits table in NCCI tool, the modifier indicator of 0 tells the user what? A modifier is allowed. B, the codes are not bundled and a modifier is not required. C, a modifier is not allowed. Or D, the edits are not applicable to this code set. To answer question 1, you must understand what the PTP is. Procedure-to-procedure edits define pairs of HCPCS and CPT codes that providers shouldn't report together for various reasons. PTP edits prevent improper payments when you report incorrect code combination. Each edit has a column 1 and a column 2 HCPCS or CPT code. If you report the two codes of an edit pair for the same patient on the same date of service, the column 1 code is eligible for payment, but the column 2 code is denied, unless you have a proper modifier. The indicators on the table define whether a modifier is allowed or not. The indicators are 0, not allowed, 1, allowed, or 9, not applicable. I would recommend writing these in your CPT manual somewhere for easy reference on test day. Knowing that 0 means a modifier is not allowed, let's revisit the question. When using practitioner PTP edits table in NCCI tool, the modifier of 0 tells the user what? C, a modifier is not allowed. This means the two code pairs can never be billed together. Question 2. In this example, you will see a snippet of the NCCI PTP edits table, similar to how the actual CPB exam is set up. A claim is denied for 58100 when billed with 58150. According to the NCCI edit, the biller should review the claim and do what? A, refile with 58100 only. B, add modifier 59 to 58150. C, refile the claim with modifier 51. Or D, refile with 58150 only. To answer question 2, we must understand how the PTP table works. The Physician-to-Physician National Correct Coding Initiative edit table is a tool used by Medicare and other payers to ensure correct coding practices in medical billing. It helps prevent improper billing by identifying pairs of services that should not be reported together. The PTP NCCI edits are based on clinical standards and guidelines to prevent unbundling, which occurs when a procedure is split into multiple codes to increase reimbursement. The table includes code pairs, which consists of column 1, noted as A in our example, and column 2, noted as B. The column 1 code represents the primary service, while the column 2 code represents the secondary service. The next column we will focus on is E. This column uses the modifier indicators we discussed in question 1. There will be a 0, 1, or 9 listed. In this example, there is a modifier indicator of 1. This means the codes can be billed together when using proper modifiers. When we review question 2 again, we will check the modifier indicator column and note a 0 indicator. 58100 is bundled into 58150, and a modifier is not allowed, and the modifier indicator 0 for the NCCI edits indicates that a modifier is never allowed. 58150 is the most extensive code and should be the code billed, making D the correct answer. Refile with 58150. This is because it is in column 1 and is considered the primary procedure. Question 3. According to the NCCI table, when an excision of a polynidal cyst or sinus, simple, code 11770, is performed, and a simple repair, 12002, is performed at a different location, how should this be reported for a commercial carrier using the NCCI edits? In the NCCI table, the column 2 code is included in the column 1. A modifier indicator of 1 allows the use of a modifier when the documentation supports it. In this case, 12002 is included in 11770. If documented, they can be reported separately with a modifier because they were performed on different locations. Modifier 59 is appropriate. Using the process of elimination, only D has a modifier. Let's explore one more NCCI table example. A patient returns to the office for a planned removal of a 1.1 centimeter lesion on her neck. She also complains of symptoms of an upper respiratory infection. The physician removes the lesion as planned, 11422, and performs a medically appropriate history and exam with low decision-making for her URI, 99213. How should this be reported? In this situation, I would use the process of elimination first and eliminate D as an answer. The 59 modifier is never used on an E&M service. In the NCCI table, the column 2 code is included in the column 1 code. A modifier indicator of 1 allows the use of a modifier when the documentation supports it. This case identifies an office visit was performed separately from the surgical procedure. It is a minor procedure, making modifier 25 appropriate. Let's round out our discussion with a question about MUEs. A patient undergoes aspiration of multiple breast cysts. 2 cysts were aspirated in the left breast, and 3 cysts were aspirated in the right breast. Use the following medically unlikely edits, also known as MUEs, the table listed to determine if the claim is correct. The claim is billed with 19000 times 5 and 19001 times 5. Medically unlikely edits are a system used by Medicare to limit improper payments for services or procedures that exceed a certain number of units. Essentially, MUEs set the maximum number of units or services that are likely to be billed correctly by a provider for a patient on a given day. These edits are designed to prevent billing errors and fraud by flagging claims that exceed a typical or expected number of services for a procedure based on clinical guidelines or historical data. Let's revisit the question. A patient undergoes aspiration of multiple breast cysts. 2 cysts were aspirated on the left breast, and 3 cysts were aspirated on the right breast. Looking at the MUE table, we can see that 19000 allows for this code to be billed twice, while 19001 allows for this code to be billed 5 times. Let's review the codes. 19000 is puncture aspiration of cysts of breast. This parent code is allowed twice because there is both a left and right breast. We can see the plus sign on 19001, making this an add-on code. This add-on code is for each additional cyst up to 5, regardless of the laterality. Using the process of elimination, based on the information we have, we can see that 19000 should never be billed more than twice. Therefore, that eliminates any answer with 19000 with more than 2. A, B, and D. As a reminder, modifier 50 indicates bilateral. Code 19000 with 50 modifier is used for 1 breast cyst aspiration in each breast, with 19001 being an add-on code for each additional breast cyst aspiration in either of the breasts. According to the MUE, code 19000 can be reported twice. Add-on code 19001 is reported with 3 units for the 3 additional cysts that were aspirated. Thank you for joining us. For more CPB practice exam questions, please visit our website at medicalbillco.com.